Hello, I'm Dr. Jason Moore, and today I'd like to share with you some common causes of disc bulge and disc herniations, as well as some of the most effective treatment options for this condition. Disc bulges and disc herniations are typically caused by either a major or minor trauma. An example of a major trauma would be a car wreck. An example of a minor trauma would be things like bending, stooping, twisting, sitting in a fixed position for long periods of time over a period of time can cause that disc to either bulge or herniate somewhat. Now, there's some things that are with the anatomy when a disc bulge or disc herniation occurs. The disc is a cartilage, round cartilage between the vertebrae in your spine. Now, this cartilage, inside of it, there is a fluid. When there's an injury to the area, what can happen is that the fluid can push against the outside cartilage, causing what's called a disc bulge. If the injury is bad enough, it can actually push the fluid so much so that it breaks the outside surface of the disc and extruding out, and at that point it's called what's called a disc herniation. And that disc herniation can pinch on the nerve and cause problems in the area as well. Now, some therapies that we use in our office to try and treat that effectively, what we use is what's called chiropractic adjustment, the electric stim, and mechanical traction. Now, the chiropractic adjustment is a very safe, effective form of treatment for this problem. What we do is gently move the spine and mobilize the problem area to help reduce the disc bulge or disc herniation and help relieve your pain. We use what's called electric stim, which is a very light electric current. Basically what that does is it helps reduce inflammation in the area, it helps get the muscles to relax, helps block the transmission of pain from the area to your brain. Basically acts like an electric massage to the area. Usually feels really well. We also use what's called mechanical traction. This is, again, it's a table that we put you on. It's a massage roller that comes up and helps mobilize and separate the joint out, thus taking pressure off of the disc and help alleviating the disc bulge or herniation that way. Some of the symptoms that people have when they have a disc bulge or herniation is pain right in the specific area of the problem. They also have muscle spasms around it, basically because the muscles are trying to protect the area from any further damage. And they also notice a lot of decrease in their mobility and flexibility in the area. If the disc bulge herniation is in the lower back, they can experience numbness and tingling, weakness in the legs, trouble walking. They can also notice if the disc bulge and herniation is in the neck, they'll notice numbness and tingling in the arms, radiating pain from the neck down into the arms, some examples of that. Now, when our patients come here and they have this problem and they receive treatment from us, typically what they tell us that they notice that they're able to work longer periods relatively pain-free, thus helping their performance at work. They're able to take care of themselves better with less pain, able to shower and clothe themselves and put on their shoes and socks in significantly less pain on a daily basis. They're also able to sleep longer periods and get a better quality sleep because they're not tossing and turning all night from the discomfort. Again, if you have a disc bulge or herniation or in pain, my name is Dr. Jason Moore. Give us a call at 304-523-7891.